Welcome to 24/7.
Also, during the first week, after that particular
welcome back to 247 Health Matters. Your health coach, Dr. Dayo, Dr. D for short. Happy to be with you once again. Last time we began a very important topic, and we're looking at the different health domains that matters to you in order for you to attain your health goal for 2026. Began with the metabolic domain. Today, we'll be looking at the cardiovascular domain. Cardiovascular disease is the leading cause of death globally. So because of that, I call this the killer domain, or the leading killer domain, as you want to call it. First indicator that truly matters is your blood pressure. Single measurement of blood pressure does not count because it's quite often misleading. So we'll always propose or advocate that you check your blood pressure at different times of the day. Early hours of the morning when you wake up, and towards night before you go to bed. The reason for that is because stress and anxiety, especially during the day, has impact on your blood pressure level. So we want to be sure whether the blood pressure measurement is true or is just false as a result of the activities or the stress or the anxiety that you have gone through. Blood pressure, no matter how small it is, elevation in blood pressure has been shown to have significant impact on kidney damage, stroke, and heart attack. So we need to be very careful and take our blood pressure very seriously. Small increase like about 20 milliliter of mercury in systolic blood pressure and greater than 10 milliliter of mercury in diastolic blood pressure has been shown to double the risk of stroke and heart attack. So, when I say systolic blood pressure and diastolic, for those who have not been accustomed to this parameter, so the systolic blood pressure is that number on top when you measure your blood pressure, that's systolic blood pressure. The one below is the diastolic. So when increment of about 20 milliliter of mercury above normal and greater than 10 milliliter of mercury from the base, that's the diastolic, has been shown to predict, or rather increases your risk of having stroke. The next indicator of your cardiovascular health is your cholesterol, or your lipid profile. I think I've spoken about that in our previous session. I did mention that the different items that we look at when we're looking at your lipid profile. Talked about the triglyceride, the LDL cholesterol, that's the low density lipoprotein cholesterol. Then we have, of course, the HDL cholesterol. So I did also mention that these three, you can decide to call them the good, the bad, and the ugly. The good cholesterol is your HDL, the LDL is the bad, while the triglyceride is the ugly. So I've also mentioned that how each of these are produced and what they do in the body. Elevation of LDL cholesterol, which is the bad cholesterol, predicts the development of atherosclerosis, which eventually will lead to blockage of the arteries, and of course, which is an harbinger for the development of stroke or heart attack. The good cholesterol is good because it mops up, clean up excess cholesterol in the body and to ensure that it is transferred back to the liver. Your triglyceride is usually elevated in the setting of excess calorie or excess binge of alcohol. So desirable lipid profile would be a total cholesterol level of less than 200 milligram per dl, LDL cholesterol level of less than 100 milligram per dl, and triglyceride level less than 150 milligram per dl. I think that would be ideal. And of course, also the good cholesterol HDL level of greater than 60 or 80 milligram per dl would also be desirable. So high level of LDL cholesterol, low level of HDL cholesterol are bad for your health. So you need to fix that. The next very important indicator of your cardiovascular health is your resting heart rate and your heart rate recovery. So the heart rate is usually, the normal heart rate is between 60 and 100 beats per minute. However, the desirable level that is compatible with your cardiovascular health is a value between 60 and 80 beats per minute. Anything above 80 beats per minute has been shown to increase your risk of cardiovascular disease, including heart attack and heart failure. So your heart rate is also very important. Next to your heart rate is your heart rate recovery, which is a function of your autonomic function and your cardiovascular fitness. A recovery of about 15 to 20 beats per minute, that's a drop in your heart rate after an exertion within 1 minute, is good. It's a sign that you have very good cardiovascular fitness. The third domain of health we'll be looking at is the muscle strength and physical function, which we call the longevity domain. You know, many of us look at the muscle as a cosmetic tissue. We think about the Arnold Schwarzenegger and somebody walking out to the gym with a big muscle. You know, beyond that, do you know that your muscle bulk predicts your survival, how long you live? The muscle is a good glucose disposer. So as much as about 70 to 80% of the glucose that you ingest after a meal is used up by your skeletal muscle. And beyond that, muscle is also a good metabolic buffer. And like I said, it predicts your survival and how long you're going to live. So people who have low muscle tissue tend to increasingly fall, and they also are prone to disability and insulin resistance, that means poor glucose control, and also they tend to die early, relatively, compared to those who have higher bulk muscle. Next time when you think about muscle, building muscle, doing resistant exercise to build your muscle, think about survival, not just cosmetic, that you want to build six packs or you want to build big muscles so that you look good. It's beyond that. The functional indicators that we should consider here, number one is your grip strength. So under the grip strength, we have your crush grip. When you squeeze an object, how much pressure or force do you apply when you crush an object? The second is your support grip. That is the ability to be able to hold an object for a continual period of time, a reasonable period of time. The third is the pinch grip, when you hold an object between your fingers. So these three parameters are used to determine your grip strength. Your grip strength predicts your frailty, how frail you are, how strong you are. And it also predicts whether somebody is going to be hospitalized or not. And lastly, it also predicts mortality, that means death. So it's a very useful tool to determine these three parameters. The next very, very important tool here is your sit to stand test. How many times can you stand and sit in a sitting position over 30 seconds? An average healthy individual should be able to do that for at least 14 times. So if you are not able to do this for 14 times, that means your physical functioning is a bit questionable. The last but not the least, under your physical functioning and muscular strength, is the ability to perform daily tasks without fatigue. Very interesting. Ability to be able to climb upstairs, ability to be able to carry buckets of water, maybe to the bedroom. And lastly, is the ability to be able to stand from the floor. So if you go down, ability for you to be able to stand up. So this is also used to determine your physical functioning, the muscular strength. This is also very, very important. This brings us to the end of this session. Next time, we'll be looking at the concluding parts of this series on how to create a workable, realistic plan for 2026. But please remember to like, also subscribe to our channel, and share with someone who will benefit immensely from what we have talked about today. Till I see you next time, I remain your friend, Dr. D. Remain healthy.